I'm having a slightly unconventional breakfast because Christo has left all the cheese from his final item this morning, and it's very nice. So cheese and crackers, I feel very decadent. Listen, it's an absolute pleasure to be with you here between now and 1 o'clock. Plenty to get through, so let's get straight into it. Should the COVID-19 vaccine be mandatory for care staff? This is an interesting one because thousands of care staff are facing losing their jobs and being forced to leave the sector because the deadline to be double jabbed for COVID-19 has passed. That's from Thursday. All care home workers in England must have been double jabbed unless they're medically exempt. 50,000 of them could be affected. And of course, the Health Secretary, Sajid Javid, has said that by April, all NHS staff will have to be double jabbed as well. So I think a number of care staff thought they could perhaps work in the NHS. There are obviously shortages there. There are over 100,000 shortages in the care system. So this is a really hot topic. And of course, those costs are rising for people in the care system and of course, care providers. Let's talk to Dr. David Lloyd. He's a GP at the Ridgeway Surgery in Harrow. And Dr. Renee Hoenderkamp, who's a GP and medical writer. Let's start with you, Renee. This is surely fairly straightforward. The vaccine works. People getting the vaccine are protected against COVID. They help people around them. Surely they should be vaccinated. Surely this is a pretty straightforward argument.
I think it is a really straightforward argument, Peter, but I don't think that's the argument. I think you need to pick it apart and look at the arguments that people are using for it. So in the first instance, vaccines do not prevent transmission. Yes, they may prevent infection, but once you're infected, they don't prevent transmission. So there is no way that having a vaccine passport guarantees that a care worker won't be transmitted COVID. In fact, they may feel actually quite secure in their
Renee, your line isn't great. I do apologise for cutting you off there. We're going to try and get a better line from you, and we'll come back to you and give you equal time, I promise. David Lloyd, Dr. Lloyd, GP at the Ridgeway Surgery in Harrow. What is it about this policy that you dislike in terms of what Renee is saying? Surely you think this idea is a good idea, that all care workers in England should be double jabbed. Tell us why you think that's a good idea.
Well, the fact is that we've got 1.5 million people actively with COVID in this country as we speak. I know rates are going down, but it's still a huge issue.
1.5 million people with COVID
at the moment, yes, in the UK. So there's an awful lot of people. There's an awful lot of virus going around, and unless you're protected, you run a risk of dying. And the people that come into contact with COVID the most are people that are working with it every day. So we're talking about healthcare workers and social care workers. And so we should be protected. And you sometimes don't know that you've got the virus and that you're actively spreading it. So you do need to be vaccinated. You do need to be protecting people that you're looking after. One of the great tragedies, as you remember from the very beginning of this, is that the first cases of COVID were actually picked up when people were treated in hospital, and so we've got to create environments that patients feel safe in, so that they can come and see us, and we've got to protect people who can't have the vaccine. Just like every other thing, we vaccinate children against measles, not just because it protects young children from measles, but it protects people who can't have the vaccine because of they're very, very ill. So it's very important to get this herd immunity, as they say, up so that we can try and beat this virus, which is really, it's a terrible thing. I live with it every day, and every day I'm admitting unvaccinated patients with COVID to hospital, and the vaccinated stay well. So the argument is overwhelming. I guess the next thing I would say is that the only analogy that I could come up in the morning as I was preparing for you is would you appoint a bishop that doesn't believe in God? I mean, I think that's the sort of philosophical thing.
Renee Hoenderkamp, David Lloyd says the argument is overwhelming. What do you think about that?
Yeah. Okay, so picking apart those points, I think obviously I'm working in North London as well, so I'm seeing people every day with COVID, and right now the figures don't support that it's just the unvaccinated getting COVID. In fact, vaccinated people are contracting COVID every single day. Hopefully, So this
But
is
they're
not me
not
saying that
dying.
the vaccines, they're not dying. Hopefully they're not dying, but they are dying, but hopefully they're not. So the vaccine has worked in that it is stopping those people at risk from dying, which is a brilliant thing. But those vaccinated people who have COVID, who could be care workers, are still transmitting it. So this argument about transmission doesn't hold. But there's another aspect here. We do vaccinate our children, mine included, I promise, all of them, against other diseases to help society. But we do that with vaccines that have been around for decades, and we have long-term data. And we now know very quickly, because we don't have any long-term data, but we now have some medium data on the vaccines, that some people have died because of the vaccines. Now, I'm not saying don't have the vaccines. I've had the vaccine. But my point is this. Nobody should be able to say to you, you must take this risk for other people, which may kill you. And it doesn't matter how small the risk of dying is from the vaccine. To mandate it is telling people you may die. Let's look at the BBC presenter, Lisa Shaw. She was a mother, a daughter, a wife, a sister. Now, how do her family feel if she was made to take the vaccine? She didn't. She chose to take it, which is fine. And I absolutely encourage people to make that choice. But I would never say to somebody, another human being, I'm sorry, this is a risk you might have to take for the rest of society. You might have to die. The chance is really tiny, but it is a risk you're going to have to take because I said so.
Because David Lloyd, that's the point, isn't it? When you're saying that, I mean, I look, I'm double vaccinated. I had my booster jab this week. I'm very grateful to the NHS for the vaccine. I think everybody should get it, but I also think that people should make an informed decision. I informed myself, and as a result of that, I got the vaccine and I've got my boosters, a booster, I should say. A number of people inform themselves and decide that they don't want it, and I don't want to judge those people. I don't want to preach to those people. But it's interesting. It's different, isn't it, in the care system and soon within the NHS, because you are mandating people to put something into their bodies that they may not feel happy about.
I just don't see that argument, I'm afraid. The science is totally overwhelming about this. We are asking people to do something to save the world.
But the point is, I mean, it's asking. I mean, there's a difference between asking someone and demanding someone does something. Your job will be taken away from you if you don't put this in your body.
In France, you can't go to school unless you've been vaccinated.
And that's very wrong. That's very wrong.
I think it's very right.
No, my child would get withdrawn from school if mandates were made for vaccines. And my child has had every vaccine, but I wouldn't allow her to go to school if the COVID vaccine was mandated.
Oh,
end of story.
Renee, sorry, we're losing your line again. David, tell us what your thoughts are in terms of the fact that, I mean, what effect will this have on care homes? Do you think these 50,000 people are going to lose their jobs, or do you think they're going to just take the jab, do you think?
So I can't speak about the numbers because I haven't seen the number of care workers that are going to be made redundant, which is very sad. But in my small 30-man team at my surgery, we have one nurse who at the moment is saying that she won't get vaccinated.
So will she lose? Would you be happy to say to her in April, I'm sorry, you've got to leave?
No, I'm going to be absolutely devastated. But if I can't persuade her between now and April, that's what's going to happen.
Renee, final word to you.
Yeah, I mean, I think this is really bizarre. I don't think it will happen in April because I think the announcement has been made to nudge care home workers to have their vaccine and to not defect to the NHS. If it was so important that we keep people alive by having a vaccine, why would we wait until the worst part of a COVID wave is over, winter? Why would we wait until April Fool's Day, which is when they're going to apparently put it in? It's not going to happen. We mustn't tell people to give up their livelihoods to save someone else. We must encourage them and we must give them the benefits and the risks, but there are risks. And when there are risks, you can't tell someone they must take a risk of dying for someone else.
Okay, Dr. Renee Hoenderkamp and Dr. David Lloyd, thank you both very much indeed for joining us on Talk Radio this morning. Okay.